So the next one is Captain Marvel. So we've got Pam, who's the consultant presenting at the governance meeting. Omar Toma is the clinical director, and Zubair Ringshaw is the consultant supporting the clinical director. And he'll help out Omar if he's struggling. So the scenario is as follows. As I said, Omar is the clinical lead of the department. At the governance meeting, Pam is presenting about a colleague and a dossier of another consultant's work, and then sending it and is talking about sending it to the divisional director as they're concerned about the quality of the consultant in question. There have never been any concerns that you suspect Omar as the clinical director and you suspect a personality clash. So the question is, how do you approach the scenario? Again, you'll have up to 10 minutes to resolve the scenario together, and then there'll be 5-minute summary from the panel.
Oh, hi, Omar. How are you? It's good to see you.
Right. Good to see you as well, Pamela. How are you?
I'm really good, thank you. It was good to get the meeting done, wasn't it?
Yes, definitely. Yeah, we've got a lot to go through.
Yeah. I just wanted to sort of pick your brains about what you might have thought about, my presentation. As you know, I'm paired up with James Gill in terms of discussing what we will bring up to the meeting with regards to issues mainly, within the NEE team. So as you know, I'm paired with Zain. We are paired with Shara Registrar, and James is now. We're very lucky. We got Rachel Clegg just employed as well. So it's a NEE firm with James and Rachel, who's just joined us, and then myself. And Zain as a lower limb firm, because Zain does a bit of hips and knees, as you know. And
sounds like a good team.
And I just wonder what you thought of the the presentation. James and I speak all the time, and we have a very close professional relationship, and James and I, we had coffee this morning together, as we do every day. And, James and I thought it would be good to raise things formally. And that's why I put, I spend a lot of time putting things together for everyone in a presentation.
Yeah, can I just clarify, just to make sure that you've got concerns about Rachel's work, is that correct?
Oh, no. So Rachel's just joined us. Okay. She's fantastic. I've worked with her before. We go to BAST together every year. I mean, Rachel and I, we're tight.
So your presentation was raising concerns about who exactly? Sorry.
Sorry. I apologize. It was Zain who.
Okay. All right.
Zain and I, as you know, we have a firm together, and it's really just a fact, as the presentation showed, some of the decision making, it's just, again, James and I discussed this over coffee, and it's just not quite in keeping with, the standards that are set by, the BOA and BASC, and I know Zain is also spends a lot of time doing hips as well. So
okay. A very interesting presentation. Obviously, thank you for bringing it to our attention, because I'm sure you're all aware that our number one focus is the patient safety here. And if there are any concerns about any of our colleagues, even myself included, in our clinical work, that must be raised as early as possible, and obviously, as a clinical lead, I need to know about these issues so I can take action about it. Again, thanks for letting me know about this. So I will have to, I'm going to take your concerns highly into consideration. I want to get some more information about this, do a bit of fact checking.
Of course, I've sent you a spreadsheet, by the way, with all of the exact numbers, all of the patients' numbers in it, exactly where our concerns lie. It's all, you know what I'm like. I really like to make sure that everything is perfectly presented and organized. And as I said, I have James and I, we are on the same wavelength about this.
Okay,
and,
good.
of
That'll
course,
be very
Rachel
helpful,
joined,
because
so-
that'll be my starting point to go from there. Obviously, I'll need to talk to Zane as well, see what's happening, look at his numbers, because, I mean, as you know, you can't make a decision on X-ray with just one view. So I'd like to get his view on things. And the more views I can collect about the issue, the more information I can get, which will make decisions easier to make. I'll have to speak to the people that work with him in theatres, his scrub nurses, his nurse practitioners, see how they have they seen anything unusual. Because to be honest, I haven't actually heard anybody else raise any suspicions about Zane's work. So this is a first, but obviously we'll have to look into it, because I mentioned, as before, patient concerns my number one issue here. So I'm going to start immediately collating as much information, starting off from your good work that you've given me already. That's a foundation of what to go on from there. But obviously there's a procedure of how to do this. I have to go through all the levels, got to talk to lots of people, look at his outcomes of previous hips and knee surgery, look at his revision rates, look at the NJR and all of those different numbers. And then I'll take it from there. And rest assured that your concerns will be taken into consideration. And I think that it's very good that you brought us to my attention. And I will do my best to address this issue as soon as possible.
Yeah, so I think just to sort of be clear about where the concerns lie is mainly to do with performance. It's a performance-related issue because, as I said, James and I, he came over to mine the other day. We discussed it over dinner, and it's just not really in keeping with, the standard of work that us, as particularly on the side of the decision making around arthroplasty and soft tissue knee. As I said, also the trauma, as you'll see from my email. But yes.
Okay. Yeah. Well. So I will look into it, and obviously I need to talk to Zane first of all, find out what's been going on, and take his view on the issue. And I'm sure as you are well aware, if I swap situations and Zane was raising a concern about yourself, you would very much want a very fact-based, objective investigation going, and to take all the information into account rather than jump to conclusions.
Of course, I wouldn't expect. Omar, I wouldn't expect any less from you, of course. And that's why, I spent a long time putting all of these numbers together and put them through James. And as I said, we're in the same wavelength. And, we've got to support Rachel. She's just starting. She's fantastic. I mean, we've been to BASC so much. And I know that, that she will, she has the same standards that James and I share.
It seems that you and James and Rachel have a very good relationship, and it's obviously it seems that Zane isn't part of your social group, but at the end of the day, we're here as professionals, and we have to put our personal views aside and ensure that the patients received the optimal care. So as I mentioned, I'm thankful for your work, and I'll take that and get onto it straight away. But I have to leave all feelings aside and just look at the raw numbers, look at the raw evidence, because at the end of the day, the numbers will tell me a very good story. And if that in any way shows any compromise in performance affecting patients, then that will be a priority number one to alleviate that problem. And I will undertake that with immense importance.
Very well done now, Omar. You well acted as well. Again, I will, for the sake of the audience and any prospective employers, this is not Pam at all. This is a pure act. And
probably obsession with evidence and organization.
Yeah, I would have expected that spreadsheet to look fantastic. Yeah.
Whilst Sunny, can you put up the poll again to see if this is a situation that people have experienced? And whilst Sunny's putting that poll up, Zubair, what did you think?
Well, it was a well thought out scenario, I would say. Very well received by Omar, and I guess he raised genuine questions about the other person involved, I guess James. So I thought we should go to inquire further about it before making any decision regarding whether Zheng has any incompetencies or anything related to it.
Mhm. Okay, yeah, and did you was there anything that you thought Omar did very well?
Yeah, I guess Omar did everything very well start from the start.
Yeah, well, go on. So what are the things that you would have perhaps done differently, or that you will do differently now in the future because of watching Omar's style?
Perhaps I would like to I would like to get more people into it before making any decision. I would like to inquire, as like Omar already pointed out. I would like to interview more people like who are working with the Zinc. So
Yeah.
before making any decision, and I would
I
also like
love-
to ask.
Omar
Sorry?
summarized that beautifully, didn't he? With a beautiful orthopedic quote.
Exactly,
The like an X-ray, get two views. Yeah,
exactly.
Omar, that's gold dust. Thank you. I'm going to steal that. But yeah, so yeah, I thought he handled that very well in terms of stayed calm, didn't get excitable. Also, what else did he notice? About Pam's comments that he kind of brought out towards the end?
Are you asking to me? Sorry.
Yeah, Zubair. Yeah. Did you? We'll ask.
I think that. Okay.
Go on, Omar.
I think
What did you think was happening?
Well, it seemed that Pam and James were very cushy together, and they might have got a grudge over Zayn. It seems like they've got their own little clique going on, and they excluded Zayn from all of their social life, and hence maybe there are some competition issues in the private sector, that sort of thing that happens sometimes in the consultant world. So there's
Not in the knee surgical world. That's your unconscious bias.
Because I had thought of that. I was gonna ask you. I was gonna let you ask me, but I was gonna say that I had a phrase of, "Oh yeah, we evaluated him at BUPA, and we decided that he wasn't a good fit for our team."
Yeah. So usually issues in the private sector tend to affect working in the NHS sector because there's a lot of competition going on, and so people's personal competitions and then feelings about issues, even if they might have had an argument about something a while back, then it just builds up and it feeds into a system, and then it goes into this vicious cycle, and then it ends up with concerns being raised or issues like this being raised.
And how did you? Was there anything else that you would have wanted to say or do if you had the chance to, or do you think that was enough time?
Yeah, I guess, I mean, like Zubair said, I should have mentioned talking to James as well and Rachel, because they all work together, and interview them separately to see how if they have different views or if they all share the same concern. And so that would be something that I would have added on to it as well.
What if that's really good, actually. Yeah, interviewing them separately and making sure that you got the full picture. But what if it sounds like Rachel's being brought into the band as well, into the team? So you did mention about other external colleagues. One thing that I would ask you not to say, it's like being an examiner. Never say good to the answers. You have to be poker faced.
Okay.
I don't know if that's and the less you say, perhaps the better. And because you started to kind of perhaps reinforce. I felt that Pam felt that you were siding with her by saying
I was bamboozling you with my spreadsheets and my emails and stuff. Yeah.
Yeah, and you the reason why I say that is that you were saying that's good work, your good work and good evidence, It just felt that, I don't know, how did you feel when he said that, Pam, when he said it was good?
Yeah, I thought I got this guy. He's gonna look at my spreadsheet and go, yeah, she's right. And I'm gonna have the other thing that was gonna come out was, if you've asked me whether there were issues, was the private sector competition, yes, but also that we share our registrar and then we share our team and how that was working out basically. But yeah, but I did think when I kept mentioning my spreadsheet and you kept nodding, I was like, physical, he's listening to me, he's getting what I'm saying. Yeah,
I guess it's a way of disarming the other person to say that, yes, thank you very much for your work, I'll look into it, and that keeps them happy because they put a lot of effort into that. But it's also a way to say that I got it and now I will take it from here, because this is just, like I said, it's the beginning of a long process. So I didn't want to say that, oh, thank you very much, I'll now use this to go from here. But I said I'll use it as a foundation and build up from there. But thanks anyways for bringing this up.
Yeah, you're absolutely right. It is just the beginning and of probably a long and protracted journey. And how do you think it will play out?
Well, it all depends if the allegations are actually correct or not. So no comment.
How do you think Zain will be feeling after all this has been investigated? Well, Pam, what about you, Pam? How do you think he'll feel?
Awful. I've provided a listening ear to someone that was going through this. As I won't say what kind of relationship we had, obviously professional, but and I know that they found it very, very difficult, very, very difficult. It was all positive for them in the end, and they behaved very professionally. They continued to work with that person, but yeah, and it massively, knocked their confidence. It was difficult at the beginning. But what they did relate to me was that they also realized how supportive some of their colleagues were as well. And they managed to get through it. And actually now, interestingly enough, from the latest I know about it, they actually have quite a good relationship now. So it's all turned around. Not perfect, obviously. Things are not perfect, but civil enough to work together. Yeah.
And what do you think? So sometimes it's not a kind of a jealousy thing. It's not a vindictive thing. There are personalities who are meticulous may feel that they are acting as guardians for patient safety, and so they are the whistleblower, and don't. So from the other perspective, if we're on the receiving end, maybe we need to just think about, oh, hold on, are they doing it just genuinely from the bottom of their heart because they really care about the patient, or is it other things as well? But if it continues to escalate, Omar, do you know where it goes next?
Well, then it goes up to the clinical director of the hospital, possibly the GMC, depending on how bad the allegations are. Obviously, there'll be tensions within the department as well about this. People will be more stressed out, even people who are unrelated to the issue, because this has been raised. So it will be a stressful few months or longer, depending.
Yeah, could be years. Once again, I ask, I don't know if Pranay or Miss Bose, Deepa, have you had any kind of knowledge of and experiences of this kind of situation? Is this something that you've come across?
Not quite as openly as that. Possibly a lot more subtle than that, and that just makes it sort of more difficult, I guess, to pick up on. Yeah, I must say, I thought you did very well there with that scenario. You handled that really nicely.
Yeah, and Pranay, have you
Yeah, I think from Nick Oresti's pre-recorded lecture, I think it's really important to sort of understand what are the potential causes for conflict. You know, is it personality? Is it substantive? Is it because you're fighting over resources? You know, and things like that. And I think that's really important to gain a better understanding. But Omar did a great job at sort of saying, I'm going to collect the facts and deal with it systematically. I think that's really important. No, I haven't. Thankfully, I haven't had any issues like that as of yet.
So this is something, so Sunny put out the poll, and he was it 31% have experienced?
So again, same question. Is this something you've experienced? 39%.
39%.
Yes, and 61% have said no.
So you know, once again, it is a common scenario. I know of 3 episodes of this happening to consultants. I've also seen it happen to some trainees as well, not usually trainees amongst themselves, but other colleagues. And you know, it must be horrible to be on the receiving end of it, and I wouldn't want to be ever party to that. But you know, it probably is going to become more and more prominent, and how you deal with it is going to be important. But if it was, for example, the clinical director that was involved with it, or the clinical lead, whatever, a clinical director, divisional director, and there was conflict between them, or you couldn't resolve it with the clinical director, then there is a separate kind of attack that you could take, which is to employ a mediator. And there are professional medical mediation companies available, usually staffed by ex-lawyers, medical legal solicitors, and I'll give you I'll signpost you to that in after the next scenario. But thank you very much, Omar. Well handled. Thank you very much, Pam. Nice spreadsheets, and well reflected, Zubair.